Y'all know me, I'm Dr. B, and this is The Buzz on fifth disease. Fifth disease, and that is hard to say, fifth disease is a very common childhood problem. Just about every kid will get this disease at some point. Here's a whole nest of kids who I assume are in the same family who all got this disease at the same time, and it's usually very benign. That's why one of them is smiling. This disease is caused by a virus called Parvovirus B19. A lot of people say, Parvovirus, isn't that a dog virus? Yes, dogs and humans do both get parvoviruses, but this one is specific to humans, Parvovirus B19. So you cannot catch it from a dog. This disease has several names. It's called fifth disease because it's one of the historical 5 classic viral rashes of childhood, and it was the 5th one named. It's also called erythema infectiosum, which is Latin for infectious redness, very descriptive. And finally, it's also well known as slap cheek disease because of the distinctive red cheek rash that it causes, which looks like the child got smacked right in the face. Fifth disease may start with fever, malaise, a little sore throat, but generally these kids feel overall pretty good. The rash usually shows up right after the fever, malaise, and sore throat start. First, the child gets bright red cheeks. Now, some kids get red in the face whenever they get any fever, but this looks like the child has been slapped. Bright red cheeks, very distinct. They may even be a little bit raised, and it spares the nasolabial folds, the area right next to the nostrils. Next, a lacy, net-like, what we call reticulated, which literally means net-like, pink rash shows up on the arms. And this is mostly on the shoulders and the outer part of the upper arms, but it can be the whole arms, and this may be a little bit itchy. Usually this rash on the arms lasts for a few days, though it can come and go for a week or two. Much more obvious is going to be those red cheeks. Lacy rash on the arms sometimes doesn't show up, and sometimes it's very faint, so it may be hard to see. This pattern of slap cheek followed by the arm rash is so distinctive that we usually just diagnose it by history and physical, and no labs are necessary. However, antibodies or something called a viral PCR test can be done if necessary in people who are at risk for having a worse outcome. Now, speaking of outcomes, for kids who are healthy and have no other problems, this infection is usually extremely benign, and they should have no problem coming through it with no long-term issues. In fact, as I said, what you'll notice in most of the pictures of these kids, what do you see here? The kid is smiling. They usually feel pretty good once that rash shows up. But for kids who have blood or immune problems, there can be some complications. There's also real danger if a pregnant mom contracts this disease for the very first time. If she didn't have it as a child, and she gets it during her first trimester that she's pregnant, it can cause major serious problems for the baby. So any pregnant woman who's exposed to fifth disease really should talk to their doctor about what they should do, whether they should have any kind of testing done. Fortunately, most people do get this disease as children and come through it with no problems. So that's an uncommon problem for a pregnant woman to be exposed to this, but unfortunately it does happen. Treatment for fifth disease is just what we call supportive care. Rest, Tylenol if you have some fever or sore throat. Staying out of the sun is actually pretty important because the sun can make the rash worse and may make it itchy. Children generally don't need to stay home because they're infectious when the fever's there before the rash shows up. Once the rash shows up, they're considered no longer infectious, especially once the rash shows up on the arms. And they don't need to stay home. They can go right back to school as long as they don't have any more fever. Well, thanks for watching today's brief discussion of fifth disease. If you enjoyed what you saw, please subscribe and share. If you don't like what you saw, please subscribe and share, and we'll have more things to disappoint you in the future. Anyway, I'm Dr. B, y'all know me, and this has been The Buzz on Parenting and Pediatrics. We'll see you next time.